How do I properly scrub in 4 med school clinical rotations? Imagine walking into the operating room ready to learn and contribute. The first step to doing that safely and professionally is knowing how to scrub in correctly. When you're in your 3rd or 4th year of medical school, especially during surgical or procedural rotations, scrubbing in is a must. It's all about maintaining a sterile environment and showing your respect for patient safety. First, you need to understand when scrubbing in is necessary. You'll do this during surgeries, emergency procedures, or any setting that requires sterile technique. In your early years, you might not need to scrub in, but once you're in clinical rotations, it becomes part of the routine. Before you start, dress appropriately. Wear clean scrubs that follow your hospital's dress code. Remove all jewelry, watches, and nail polish because they can harbor bacteria. Tie back long hair and put on a surgical cap and mask if required. This shows professionalism and keeps the environment sterile. Next, focus on hand and forearm scrubbing. Wet your hands and forearms up to the elbows. Use an antimicrobial soap or approved scrub solution. Apply the soap and scrub all surfaces of your hands and forearms for about 2 to 5 minutes, depending on your hospital's protocol. Use a sterile brush or sponge if provided, paying special attention to fingertips, under the nails, and between fingers. Rinse thoroughly from fingertips down to elbows to prevent contamination of clean areas. Pat dry with a sterile towel, moving from fingers to elbows in a one-way motion. After drying, you'll put on a sterile gown and gloves. Have a circulating nurse or scrub technician assist you. Pick up the gown by the inside collar without touching the outside. Slip your arms into the sleeves carefully, avoiding contact with the outside of the gown. The nurse will help tie the gown at the back. When it's time to glove up, use the closed or open technique as instructed. Be cautious not to touch the outside of the gloves with your bare hands. Once you're scrubbed in, keep your hands above waist level and in front of you. Avoid touching non-sterile surfaces. The scrub technician will monitor your sterile field and correct any breaches. Clarify with your resident or attending if you're expected to scrub for the entire procedure or just parts of it. Many medical schools requiring students to undergo formal training on sterile technique before scrubbing in. This might include watching instructional videos, passing a knowledge test, or in-person assessments. Always follow your institution's specific guidelines and protocols. Finally, remember to stay professional. Arrive early, follow instructions carefully, and respect the sterile environment. Showing confidence and attention to detail during your scrubbing and process demonstrates your commitment to patient safety and your growth as a future doctor. Mastering this skill not only helps you succeed in rotations but also builds trust with your team and patients.